This is the lecture for Chapter 19, Disorders of the Immune System. Disorders of the immune system can be divided into two different types. The first type is an overreaction to an antigen. An overreaction means that the immune system is responding to something that is not pathogenic, and these are sometimes referred to as hypersensitivities, because the immune system is hypersensitive, overly sensitive to something that is non-pathogenic. Hypersensitivities can be further divided into four types. Type 1 is also known as anaphylaxis. Type 2 are cytotoxic reactions. And type 3 are immune complex reactions. All three of these types, type 1, type 2, and type 3, involve the B cells. More specifically, they involve antibodies triggering the hypersensitivity. Type 4 involves the T cells, the CTLs, and this is referred to as cell-mediated or cytotoxic hypersensitivity. The other type of disorder associated with the immune system is an underreaction. So an underreaction means that the immune system is not responding when it should. So this is a loss of immunity, or it also can be referred to as when the individual is immunocompromised. And this can have an effect on an underreaction of the immune system can have two different effects. It can allow cancer to develop, and also the immunodeficiencies can leave an individual susceptible to infections. So the two types of disorders of the immune system are overreactions and underreactions. For the rest of this lecture, I'm going to focus on hypersensitivity and more specifically allergy. An allergy is a disorder of an individual's immune system where their immune system is responding to a non-pathogenic foreign molecule, and we refer to that as an allergen. This table will divide the allergens by their portals of entry. The first group enter through the respiratory system, and so they are considered inhalants. And this involves anything you inhale, so anything that is found in the air, such as pollen, dust, mold spores, dander, animal hair, insect parts, and also formalin. Formalin is associated with new furniture, new carpeting that can cause indoor air pollution that you may have heard of. Also, any drugs that are inhaled. Second group are ingestants. So ingestants are things that come in with the food, and of course this refers to any sort of food allergy, but also the food additives that are found in the food and drugs that are taken by mouth. The next group are the injectants, and injectants are injected beneath the skin. So this includes the allergies to venom, bee stings, wasp stings, any injected drugs, injected vaccines, injected serum, or any other injected treatment that involves enzymes and/or hormones. The last group are contactants, and contactants are anything that comes in contact with the skin. So that would include drugs that are in creams that are rubbed on the skin, cosmetics, heavy metals that can be in jewelry, detergents that are found on clothes, formalin, rubber, that would be the latex allergy, and different sensitivities to solvents and dyes found in clothes. The first type of allergy I want to discuss are type 1 allergic reactions or hypersensitivities, and they are considered anaphylactic. Anaphylactic reactions involve IgE antibodies. IgE antibodies are found on the surface of mast cells and basophils. And the purpose of the IgE antibody is to activate those cells. So when the IgE binds to the allergen that it is specific for, that will stimulate the mast cell or the B cell to release histamine and other mediators. And this is going to lead to an inflammatory reaction. So type 1 hypersensitivities, anaphylactic reactions, cause inflammation in the individual. And often for these reactions, the person has to be sensitized to the allergen. That means they had already come in contact with the allergen, formed a primary response, and now they have memory cells. So they have memory cells so that when they come in contact with the allergen a second time, they will have a very strong reaction. When we say somebody has been sensitized, that means they have generated memory to the allergen and they're more likely to have a strong reaction. There are two types of anaphylaxis. The first is called localized anaphylaxis, and this means that the inflammatory response remains localized to one part of the body or one body system. Localized anaphylaxis reactions can be triggered by inhalants. So antigens, allergens that enter through the respiratory system. So when those allergens enter the respiratory system, they are going to stimulate inflammatory reactions there. If they are affecting the upper respiratory system, that's what we consider hay fever. So often people who have localized anaphylactic reactions to pollen experience the inflammatory reactions in the upper respiratory system. So that's where they have the stuffiness, the inflammatory reaction, the swelling of the tissues due to the increased permeability and vasodilation of the blood vessels in the upper respiratory system. If a person has a localized anaphylactic reaction in the lower respiratory system, this is often leading to asthma. So asthma, this will be a response to the inhaled pollens or dust or whatever allergens that are inhaled, and then it causes an inflammatory response in the lower respiratory system, which can be life-threatening. Localized anaphylaxis can also be caused by ingestants. So these are the food allergies. So if someone has an actual allergy to food, when they ingest the food, it's going to stimulate an inflammatory reaction. And often that inflammatory reaction involves swelling, so swelling of the lips, swelling of the eyelids, and it also involves the formation of hives, so inflammatory areas on the skin. So that's a cartoon of one, and here is a child who's experiencing the same thing. So you can see the swelling of the lips, there's even a little bit of swelling around the eyes, and of course the formation of hives. So this is an example of a food allergy. So that's a reaction of a food allergy. Many people confuse allergy with intolerance. For instance, some people say they are allergic to milk, but when they ingest milk, they have symptoms such as gas and diarrhea. That is indicative of a food intolerance. It's not an allergy. So if they have an actual allergy, they will have these symptoms of the swelling and the hives. That's important to distinguish an actual food allergy compared to a food intolerance. The second type of anaphylaxis is systemic anaphylaxis, and this is a response to allergens that are injected. So the injectants can trigger this type of anaphylaxis, and the classic example is a bee sting. Another example are injected allergens. So when a person has an allergy to penicillin, for instance, and you inject penicillin into their body, they will have a systemic anaphylactic reaction. And what this involves is that the IgE on the mast cells and basophils all over the body are triggered to release their histamine. So histamine is released all over the body, which will cause the blood vessels to dilate and become more permeable, which means the blood volume is going to decrease as fluids leak into the tissues. And when you have a life life-threatening loss of blood pressure due to the loss of blood volume, that person will go into shock. So this is what we refer to as anaphylactic shock. It's when you have an inflammatory response all over the body because the allergen is in the circulatory system. In people who are sensitive to bee stings, they carry with them EpiPens, and the EpiPen contains epinephrine, which counteracts histamine. So histamine causes blood vessels to dilate. Epinephrine will cause them to constrict to maintain the blood volume in the circulatory system to maintain blood pressure. And this reaction is very fast. An individual who is sensitive to bee venom, for instance, they can have an systemic anaphylactic reaction in minutes. So as fast as 2 minutes, they can start to go into anaphylactic shock. Allergy testing can be used to identify different allergens that an individual may be sensitive to, and specifically for anaphylactic reactions. So for this type of testing, what they do is they inject small amounts of different types of allergen into the skin, and then they wait for an inflammatory response. Because remember, for anaphylactic reactions, the allergen is bound by IgE, which stimulates basophils and mast cells to release histamine, which will cause an inflammatory reaction. So in this example, allergen 4, whatever allergen 4 is, did not produce much of an inflammatory reaction, so this individual is probably not sensitive to allergen 4, but allergen 6 has a significant inflammatory reaction, so this individual is probably sensitive to allergen number 6. One way to reduce a person's allergic response to an allergen is by desensitization. The process of desensitization is to expose an individual to small amounts of the allergen in hopes that it will stimulate the B cells to produce IgG antibodies. So the IgG antibodies will produce so that if the person is exposed to the actual allergen, it will agglutinate the allergen and neutralize the allergen, so the allergen will be unable to interact with the IgE molecules. So if the allergen cannot interact with the IgE molecules, then there would be no degranulation, no secretion of histamine, so no allergic symptoms. And many severe allergies are treated this way, especially severe allergies to bee stings or peanut molecules. They give the individual very small amounts of the allergen, hoping to stimulate IgG, which will neutralize the allergen before it gets to the IgE, and that will reduce the allergic symptoms. And they do have some success with that, but not with everybody. The second type of allergy I want to go over are the type 2 hypersensitivities, which are also known as cytotoxic reactions. And this involves IgG and IgM binding to molecules on blood cells, which results in the death of the blood cells. And the first example of this are transfusion reactions. To understand transfusion reactions, we have to review blood types and what they actually mean. So with the blood types, the different blood groups, AB, B, A, and O, that refers to the types of antigens that are on the red blood cells. So if an individual is type AB, that means they have both A antigens and B antigens on their red blood cells. If they are type B, they only have B antigens. If they're type A, they only have A antigens. If they're type O, they have no antigens. Neither A or B antigens on their red blood cells. That you have probably learned before, but something that might be new to you is that depending on your blood type, you automatically have certain types of antibodies in your plasma. If you are type AB, then you have neither anti-A or anti-B antibodies. If you are type B, you will automatically have antibodies that recognize A antigen. If you are type A, you automatically have antibodies that recognize B antigen. And if you are type O, then you automatically have antibodies that recognize both A and antibodies that recognize B antigen. So, depending on what antigens you have on your red blood cells, that determines what type of antibodies you have in your serum. And with a transfusion reaction, it's the antibodies in the recipient's serum that causes the reaction. So, for example, if you have a patient who is type B and you accidentally transfuse them with type A, that type B recipient patient has antibodies that recognize A antigen. And when you transfuse them with red blood cells with the A antigen, then that IgG and IgM will bind to the donated red blood cells and they will cause agglutination, and then they will activate complement. Remember, when you have antibody bound to a cell, that activates complement in the classical pathway, and when you activate complement, you end up with oil, opsonization, inflammation, and lysis. So you are going to trigger inflammation in the circulatory system, so that will lead to shock. And not only that, you have triggered lysis, MAC formation, in those donated red blood cells, so you will be lysing all the red blood cells. So giving an individual the wrong type of blood could cause agglutination of all the red blood cells, lysis of those red blood cells by MAC formation, and then inflammation, systemic inflammation. So giving an individual the wrong type of blood can induce shock in a matter of hours. Another type of cytotoxic reaction is called hemolytic disease of the newborn, or sometimes referred to as HDNB, hemolytic disease of the newborn. Hemolytic disease of the newborn involves the Rh factor, and the Rh factor is a protein that you either have on your red blood cells or you don't. And if you do express those proteins on your red blood cells, your blood type is positive. If you do not express those proteins on your red blood cells, your blood type is negative. So this is referring to that particular protein, the Rh factor. To set up for hemolytic disease of the newborn, you start with a father who is Rh positive, so his red blood cells have the Rh factor. And then the mother is Rh negative. So the mother does not have the Rh factor on her red blood cells. And her first fetus, so this is the first baby she is pregnant with that actually has the Rh factor. So to her immune system, the Rh factor is a foreign protein. Normally with the first Rh positive fetus, the pregnancy proceeds normally. But during labor and delivery, that's when the woman's immune system gets exposed to the baby's red blood cells, and then she starts to mount a primary response. And the primary response is going to take about 10 days, but at the end of 10 days, she will generate IgG antibodies against the Rh factor. So, normally the first baby is born just fine, but after that baby has been born, the woman has generated memory for the Rh factor and she has IgG in her circulatory system. So the problem is when she is pregnant with the second Rh positive fetus. Because she has memory for the Rh factor, she has IgG against the Rh factor, and IgG can cross the placenta, cross into tissues, and get into the baby's circulatory system. The IgG will go into the baby's circulatory system, and it will bind to the Rh positive red blood cells, agglutinating them, activating complement, which will cause opsonization, inflammation, systemic inflammation in the baby's body, and will lyse the baby's red blood cells. All of these reactions often lead to miscarriage. The third type of cytotoxic reaction I want to talk about are drug-induced cytotoxic reactions. Drug-induced cytotoxic reactions involve drugs that have entered the bloodstream, so they could have been injected or ingested, but they end up in the blood, and also a formed element, some sort of cell that you find in the blood. So it could be platelets, it could be red blood cells, or white blood cells. But this involves the drug in the blood and one of the formed elements of the blood. So when they come in contact, the drug binds all over the blood cell, again, the white blood cell, red blood cell, or the platelet, and now the antibodies that are specific for that drug will bind to that cell and activate complement, which will end up lysing the cell. So if this happens with platelets and all your platelets are being lysed, then you will have bleeding issues, clotting issues. If it involves your red blood cells, you can become anemic if you're activating complement against your red blood cells. And if you're activating complement against the white blood cells, then you can become immunocompromised. Type 3 hypersensitivity is immune complex. So this is a third type of allergy. And type 3 immune complex reactions involve IgG binding to soluble antigen. So the antigen has entered the body, usually it's in the bloodstream, and the IgG binds to the soluble antigen. And this causes formation of complexes, antigen-antibody complexes, that then get stuck in basement membranes, or they get stuck in capillaries, and it leads to inflammation. And some of the targets for immune complex hypersensitivities are forming these complexes in blood vessels, hearts, joints, skin, and kidneys. So you have these complexes forming, getting stuck in basement membranes in the tissue and causing inflammation. And one of the major targets is the kidney, where these complexes cannot get filtered out of the blood. They get stuck in the kidney and they cause inflammation in the kidney, nephritis. So they cause a lot of inflammation. And sometimes if it's bad enough, the person will need a kidney transplant. The last type of allergy is type 4 hypersensitivity, and it is referred to as delayed or cell-mediated hypersensitivity. And whenever we refer to cell-mediated, you should be thinking about T cells. So this involves T cells being activated. Contact dermatitis is an example of type 4 hypersensitivity. And an example of contact dermatitis is poison ivy. So when a person comes in contact with poison ivy, molecules from the poison ivy bind to the skin, bind to cells on the skin, and the T cells are activated to kill the cells that have the poison ivy molecule bound to them. And remember, T cells, the CTLs, cytotoxic T lymphocytes, their job is to kill cells. So in this case, they are killing the cells that have the poison ivy molecule bound to them. Contact dermatitis can take 1 to 2 days to develop, and what you will often see is an area where the cells are being destroyed, because remember, the CTLs, their job is to kill eukaryotic cells. So when they become activated against an allergen bound to the cells, they're going to destroy those cells, and it will create areas like this. This is an example of an individual who is having a type 4 hypersensitivity on their hand, and could be to poison ivy, but you can see little areas, little blisters, areas where the CTLs are killing the skin cells that have the allergen bound to them. Type 4 hypersensitivity is also the basis for the TB skin test. So the tuberculosis skin test, this is testing to see if your immune system will recognize tuberculosis antigens. So the way this test is administered is that there is an injection of the tuberculosis antigens, and if the person is sensitive, if they have been sensitized to the tuberculosis antigens, then that will trigger a type 4 response. And what you are looking for is the activation of those CTLs. So the more inflammation you see, the more destruction of the cells in that area, the more positive the test is. This is a table which reviews and compares and contrasts the different types of hypersensitivity. Type 1, remember, is anaphylactic, and it can occur very quickly on the order of minutes, and it involves IgE. Type 2 is cytotoxic. It occurs on the order of hours, and this involves IgM or IgG. Type 3 also occurs in a matter of hours, and this involves antibodies, usually IgG. And type 4 is a different one. It's much longer. It's on the order of days, and it involves CTLs that are killing target cells. And of course, you should know the examples that I went over in lecture.